This is part 2, Market Forecast, for podiatrists hiring nail techs as MNTs for DPM salons. Disclaimer and background information. All material in this presentation is copyrighted 2006 to 2023 by Dr. Robert Spaulding and cannot be copied or shared without permission. The first version of this presentation was in 2006. This MediNail video is part 2 of a 4-part series. Part 2 is Market Forecast. Here is a market forecast. A crisis is forming in 3 distinct U.S. markets that can impact the foot care industry. First, the baby boomer market is getting older and is going to need more foot care. As more Americans are seeking foot care, the podiatry market needs ancillary extra help to help them perform this additional routine foot care. As more Americans are seeking routine foot care, the nail salon market offers nail technicians to be good partners for the podiatrists as inclusions into their programs. Baby boomer statistics are showing that there are increasing numbers of baby boomers that are becoming diabetics with special foot care needs. More people, including baby boomers, are becoming MRSA colonizers, individuals who have MRSA but are not showing symptoms of infection. The baby boomer market shows that more baby boomers are retiring with diabetes, even hepatitis B, C, and MRSA, and they exhibit more care for foot care problems due to high-risk situations. The baby boomer market also shows that they have more discretionary income than any other demographic in the U.S. Baby boomers are retiring in record numbers and they're going on Medicare. Universally, the U.S. healthcare is increasing, and at-risk patients, the numbers are increasing, with more diabetes and more claims for foot care are being declined. More foot problems in the older populations need assistance. More routine care is needed. That also translates into higher copays, where most people are paying out of pocket, and due to the lower reimbursement, doctors are looking for alternatives. So where do these people go for foot care if they don't have any insurance or it's not covered? Many times to a nail salon, where they see more at-risk patients, where a tiny wound can cause a drastic infection, even death. Nail technicians in general are not trained in the questions to ask and how to work with this particular diabetic population. Baby boomers also have more nail fungus and are seeking podiatric care more often, but many times if they don't get the care from a podiatrist, they go to a nail salon. If a nail salon is willing to treat the nail fungus, they're willing to contaminate the next client coming in. More baby boomers with foot problems are still going to podiatrists, but some go to the nail salons. And again, when you're dealing with edema or fissures in between the toes, these are ripe for potential lawsuits for the nail techs if they process this type of patient. 37 million people in the U.S. have diabetes. That's 10% of the population. 96 million has pre-diabetes, or 1 in 3, or 33%, and 8 out of 10 don't even know that they have diabetes. Baby boomers average around 5 different types of medications, including cardiovascular, GI, and pain medication. According to the CDC, regarding MRSA, or methicillin staph resistant aureus, 1 in 3 people carry the general staph bacteria in their nose, and the typical nose triangle is where it's spread from. 2 out of 100 people carry MRSA, and there are more than 80,000 cases of MRSA each year, and more than 11,000 people die from these infections. And again, these MRSA infections show up as clients every day in salons. As we already said, the second market of podiatry, podiatrists are needing help. According to the American Podiatric Medical Association, there are currently 18,000 podiatrists practicing in the U.S. The job outlook today from this government website says the employment of podiatrists is projected to grow only 2% from 2021 to 2031, the next 10 years, which is much slower than the average for all other occupations. Despite limited employment growth, about 300 openings for podiatrists are projected each year on the average over the decade. Most of those openings are expected to result from the need to replace workers who transferred to different occupations or exit the labor force, such as to retire. Another fact on the secondary market for podiatrists, currently podiatrists are retiring faster than newly trained podiatrists entering the workforce. That means foot care with fewer podiatrists are out there. We don't know if this will change in the future or other paraprofessionals, including foot care nurses or nurse practitioners, will help with this. These are the other conditions we've already mentioned, but there's a decrease in insurance reimbursements in podiatry, and it costs more to file a claim, increasing every year. Higher copays, higher deductibles, higher insurance premiums, and lower coverage, and we're seeing more foot care with less access to well-trained employees. Again, there's a decrease in Medicare reimbursements. Reimbursements to physicians have been canceled, reduced, or held the same almost every year for the past 10 years, and the cost of requests for payments or claims become more and more each year. Again, this means the podiatry markets, the remaining podiatrists will need force multipliers or practice extenders to improve the situation. So what is a force multiplier or practice extender? Employees trained to take over the non-invasive treatments for the busy physician. Examples in the past are nurses and dental hygienists. All other physicians like MDs and DOs and even dentists have multitudes of practice extenders and force multipliers for decades, and they've had these advanced trained individuals like family nurse practitioners, physician's assistants, nurses, LPNs, and medical assistants to double or triple the doctor's ability to see patients and increase the practice revenue for survivability in this new era of medicine. Podiatrists need these same advantages, resources, and practice extenders or force multipliers to increase their bottom line and their medical reach into their local communities. Podiatrists need practice extenders, which are medically trained individuals to perform routine foot care, a medically trained nail tech to perform as a podiatry assistant, providing non-invasive care and or develop clientele for medical pedicures and performing pedicures on at-risk patients. They can offer metaceutical office retail product lines and items such as foot creams and other foot care items like enhanced nail polish. So in the podiatry office, we have employees trained to take over the non-invasive treatments for the busy physician, such as trimming toenails, debriding calluses, and other non-invasive services. You could use medical nail technicians or podiatry assistants. The added advantage is they're trained to perform cash services on at-risk patients. Remember, legally speaking, Medicare does not allow the physicians to bill direct for any service not performed by the physician or by a licensed healthcare professional who is assigned a National Provider Identifier or an NPI number, like a family nurse practitioner or a physician's assistant. Physicians cannot bill direct to Medicare for their RNs, MMTs, and other medical assistants routine foot care services. Nail techs and RNs and medical assistants can perform routine foot care as cash services only that are not billed direct to Medicare or some private insurance companies. However, other insurance companies do not specify who performs the services and may accept the billing. Now, some healthcare companies, home health companies, And private insurance companies do have special arrangements with the home health care company for foot care nurses or medical nail technicians to provide routine foot care for a salary or pay per patient seen. But that care comes for a specific high-risk patient population only. In other words, the RN or MMT get paid by the home health company for at-risk patients, but not direct by the insurance company. So who are some of these at-risk patients? Patients who have a chronic illness, heal slower than non-critically ill people, just like diabetics, have a higher susceptibility to infection, people who have vascular problems. Examples, diabetes, autoimmune diseases, or people under chemotherapy, chronic circulatory illnesses. So the third market change is there is a crisis developing in the nail industry for the past 15 years. COVID shut down virtually every nail salon in the U.S. Salons are coming back fast, and podiatrists should be the leader in nail salon care. Here is a recent attack on jail nail service revenue by two very prominent media outlets. We're seeing more skin infections and viral infections like herpetic whitlow and ingrown nails being treated by nail techs. There is an increasing demand for more natural nail care services. The economy was hurt by COVID with an already media-damaged nail salon industry. Discount salons have been lowering prices to stay in business, and there's been a recent cutback on expenses such as disinfection costs that were associated originally with COVID, which did bring more attention to the need for more disinfection. The job outlook for nail technicians looks pretty good. It's supposed to grow 22% from 2021 to 2031, much faster than the average for all other occupations. In the nail technician market, I've seen a fluctuating market for artificial nails and a shift for more natural care. In the past 10 years, there have been much more incidents I've been called in for with blisters associated with callus removers that are exponentially increased the chemical reactions in conjunction and associated with hot towels, which create more cellulitic infections and morbidity. There's an increased number of serious infections and deaths being reported in the past 5 years to me due to aggressive nail tech services on ingrown nails. In the nail technician market also, there's some below market salon lower service fees for traditional salons. There's undercover reports by the media showing that only 25% of all the nail techs are following the prescribed state disinfection protocols with their disinfectants, especially with their instruments. Fewer nail technicians are enrolling in most schools to fill the salon and spa needs, and the perception is that lower enrollment is caused by lower salon revenues. There has been an increase in below market salons' lowered service fees. Lower enrollment in nail schools, which is perceived by many as caused by lower nail tech revenue. So some of the negatives for nail salons is there's fewer artificial nails, fewer techs enrolling in schools, there's this decrease in revenues, and a decrease in performance of disinfection protocols identified by the media. So additional negatives for the nail salons is there's been increased infections with several deaths that have gone unreported because they were settled out of court. Increase in below market discount salons and an increase in need for improved professional image. Here's a review in the markets. There's an increase in baby boomers with foot care problems, a decrease in podiatrists. That's changing. There is more schools now than there were before, but it's a decrease in the ratio of podiatrists to patients. And then there's been a decrease in nail tech students. So how many estimated number of professionals are there out there? Well, there's 18,000 podiatrists that need manpower. In 2018, there were 600,000 cosmetologists. Now in 23, 285,000 licensed cosmetologists are providing nail service in full-service salons. 395,000 nail techs in 2018, down by 44,000 from 2017, and they were practicing in 54,000 nails-only salons. Now there's 110,000 licensed nail techs that are practicing in 27,000 salons. Others not practicing currently could not afford to stay in the industry. For every one in the industry, there are two out of work. Here are some nail technician demographics and statistics in the U.S. Again, around 110,000 nail technicians are currently employed. And if you look down through all the demographics, the healthcare industry has the highest paying jobs for nail techs, and that's very important. So this is a perfect storm with perfect conditions for nail technicians and cosmetologists to enter the field of medical pedicure opportunities. So the question is how do we get these markets together? How can podiatrists develop trusted referral relationships to hire trained practice extenders to meet the increased patient population? How can the nail professional become a practice extender preferred by podiatrists to aid them in meeting the baby boomer podiatry needs? Ever since 1998, the answer to this is to train nail technicians to the standards required to work in a podiatry office on at-risk patients, raise the bar in infection control of the salon nail technicians who want referrals so podiatrists can comfortably refer routine clients to them. There are three solutions for nail techs. Number one, provide advanced training to nail techs to gain their acceptance by the medical community. Number two, raise the commitment by nail technicians to safer techniques to encourage physicians to refer them or hire them out. Number three, increase the public's confidence in nail salons and nail technicians through higher standards of care. In other words, the ACMFCE.org. What is the ACMFCE? It's the American College of Medical Foot Care and Aesthetics, that anyone that provides any type of foot care, including even reflexologists, can join to improve the standards for foot care excellence through sterilization, ventilation, and education. All of the MediNail classes that are taught in any manner from the ANT, MMT, CCPMA, and Masters are all approved by the ACMFCE. Industry changes. The changes must come from within the beauty industry through self-regulation. The nail technicians, cosmetologists, and schools must improve their own image by removing possibilities of negative press by increasing education, sterilization, aseptic techniques, and marketing their healthy practices. You are now through with Part 2, Market Forecasts. Stand by for Part 3, Differences between ANTs, MMTs, and CCPMAs. Why it is important to use MediNail as your online training center at www.medinail.com. You can reach me at these contacts below. The best way is calling my office at 423-756-FOOT or email me at drrspalding@gmail.com. Thank you for your interest in this program.